For the last 8 years, Congressman Mark DeSaulnier has represented California's 11th congressional district. He's a leader in Congress on the issues like livable wage, education, and government accountability. He has passed more than 60 legislative efforts, so clearly he knows how to get things done. He's one of only a few members of Congress who serve on 4 House committees and in leadership roles on 2 of those. Congressman DeSaulnier was a small business owner most of his career, including owning and operating TR's restaurant in Concord, the city where he raised his 2 sons. He is an avid runner and has completed 21 marathons. Congressman DeSaulnier is also a cancer survivor and founder and co-chair of the Congressional Cancer Survivors Caucus. Clearly, he is busy, so we are grateful for his advocacy on cancer issues and his willingness to join us today. Thank you so much for being here.
My pleasure.
Can you tell us a little bit about the Cancer Care Planning and Communications Act, the legislation that you introduced?
Yes. Well, first of all, thank you for inviting me. It's always a pleasure. And thank you for your passionate work and your advocacy. It makes a big difference. I have 2 bills that we've introduced a number of times now, and one has been introduced for this session. The other one will be shortly. One goes to comprehensive planning. So that requires Medicaid to reimburse doctors and nurses to up to an hour to prepare a comprehensive plan. So once you get the diagnosis, that you put it in writing, you communicate it, and you make sure that the patient and their family are part of that plan so that they can follow it clearly. The second one, the Navigation Act, would allow for funding for navigators. So people who are professionals and trained purely at communicating and working with the family and the client, the patient, to make sure they understand their financial situation, the diagnosis. And this comes from my personal experience, having been diagnosed 8 years ago with chronic lymphocytic leukemia, and the wonderful treatment I got, but the frustration I had as a client with the communication or lack thereof.
So can you tell us a little bit more about your cancer journey and why that's made you so passionate about improving communication between physicians and patients?
Well, in many ways, it was a great gift. I'm alive. That's obviously, it's not much of a gift if you can't use it. So when I was elected to Congress, I always like to tell my colleagues I had never had any health issues from the neck down. And then I was misdiagnosed, but finally a dermatologist at Walter Reed discovered that my lymph nodes were in very bad shape. And that he said to me, so we got to get you downstairs and get you a CAT scan because you've got some form of lymphoma and it's at a very dangerous stage. So I had stage 4 CLL. I'm fortunate to have had it at a time where there was treatment. So I had infusions with Rituxan at Georgetown, and then worked for 2 years. And I'm right as it was diagnosed, it started to come back. And since then, I've been on treatment with ibrutinib, and now I have other versions of that. So I'm lucky that these treatments are available. And most of those came basic research at NCI and NIH. Taxpayers paid for it.
Mm-hmm. Yeah. So that's why you're passionate about supporting cancer research at NIH and NCI.
Yeah.
So what was the communication like though when you found out about this? I mean, how did you figure out what you needed to do? And did you get a plan? Did you feel like you understood all of the aspects of your cancer treatment? I mean, you were fortunate to be treated at Walter Reed and then Georgetown, which are 2 excellent facilities. And I'm sure they probably treat you very well as a VIP, but it's still overwhelming to receive that kind of diagnosis.
Actually, it's interesting. I was misdiagnosed as a member of Congress. So it was a good experience because I saw, and then here at home, I was, when I was a county supervisor many years ago, I got put in the position of being the deciding vote whether to rebuild our public hospital. And I did. I just came from an appointment over there and they do remarkable work. My kids and I got our medical care at a county clinic. And very diverse, a lot of people who don't have health insurance. So it's interesting seeing both of them. But in both instances, the communication was not very good.
Mhm.
I had a meeting early on with a group of oncologists at John Muir Hospital, which is one of the best hospitals in the country and in Northern California, and UCSF, Stanford folks. And there were about 30 very well-educated oncologists. And we had a couple-hour meeting just talking about my experience and their experience. And towards the end, I said, I'm looking at your resumes. You went to Johns Hopkins and Stanford and Harvard. Did they ever teach you about communications? And the room burst out into laughter.
Hmm.
And one of the doctors said, no, we went to the best schools. We don't have to learn how to communicate. So therein lies part of the problem, is these are
Mhm.
very specialized and valuable, but communications needs to improve in this country. And we know the EU and Canada do a better job at
Mhm. And it's so important too, because if you think about, first of all, patients need to understand what's going on with them, but so much can hinge on what their doctor says to them in terms of how they hope, how much hope they have or how much understanding they have of their disease. And I don't really think it's funny. I mean, I understand these guys were laughing, in jest, but I mean, it's really actually pretty serious that if they don't know how to communicate well, then patients are left really to fend for themselves or not have an understanding of their disease, their potential side effects, their prognosis, and that affects their ability to kind of plan for their lives.
it. No, and I agree with you. It's not funny. For me, one of the passions I have, it's not funny in what created this culture.
Hmm.
And I think they were acknowledging that in spite of the fact that they did everything society gives value to, went to the best schools, studied hard, are very good at what they do, they were acknowledging their own limitations. What I feel passionately about is, what did we get wrong as a culture in a
Yeah.
country? And that's where my experience and being a member of Congress, I think, is of value.
So, how do you think that your legislation will address this disconnect between doctors and patients during their cancer treatment and beyond for those who, complete treatment and move on to sort of post-treatment survivorship, but are still left with questions about their care?
Well, I think it's about communication. In this country, we value education and rational involvement. But if you can't communicate that, whatever field you're in, it's not of great value. So we know from research that when you're diagnosed with cancer, you only retain family members and the patient optimally 1 in 4 words.
Hmm.
So the people who are communicating those words have to be aware of that. So I've been in environments where I've seen navigators who are at a lower level of education, but more specifically trained on communicating between these specialists who are brilliant and the client and are culturally competent and are multilingual. So when you see that, the level of stress and the efficiency of the system, this is my argument to my Republican colleagues. It's not just, it's about making the system work and making it more efficient. So all of those things, these two bills will help. One, because so much of it is about the reimbursement rates and being billable, because that's the system we have, is allowing for it. And the other, I think, is more important in a way, and is really just a first step, is providing funding for people who are specialized in the communication between the specialist and the client, and acknowledging that different clients have different cultural and communication barriers, and we're going to try to help that.
Hmm. Yeah, and I think it's really hard for people with such specialized knowledge to talk in terms that people who don't know anything about cancer can understand. And you shouldn't have to, become an expert in cancer to get good treatment. And we need to be able to communicate in language that people can understand. I think even as a non-medical professional, I find sometimes just because I learned a lot about this that I'll say things and like we're working on developing a survey that we're going to be sending out and we use words that make sense to me, but I have to think about, okay, that's still not an accessible term to the general public who doesn't think about cancer all the time because they haven't had any need to. And I think your point about people remembering only 1 in 4 words is so important because I know there's been a lot of studies of, asking patients what did they hear, and then the clinician will say, yes, we talked about this, but the patient isn't in a position to absorb everything, which to me argues for and add to that during COVID, when people couldn't bring that person, that care partner with them to help them, in their
Yeah.
appointments, who might be able to take notes for them or might be able to remember the things that they don't. To me, those argue even more for why a written plan is important. And like you said, could be more efficient because you're communicating it in a way that people will remember. So did you ever receive a cancer care plan from your care team? We know that most people don't. When we ask this question in our surveys, and particularly survivorship care plans at the end of treatment, but also care plans at the beginning of treatment. Did you ever get one? And if not, do you think that would have been helpful to you?
I don't remember one that was comprehensive or
Yeah.
something that I could comprehend. Well, one of my oncologists at Georgetown said when I was first being diagnosed, he said, "Whatever you do, don't go online." So naturally, I went home and I went online, and it was so confusing, because this is part of. It's wonderful to be able to Google things, but the complexity in communication. So yeah, it was, and even now, as somebody who just got an infusion yesterday, did my blood test, will go to my chart later today. All my numbers are great. But I have to live with the fact that my immune system, and of course this was highlighted by COVID, trying to do my job in Congress and the political atmosphere where Mr. McCarthy doesn't want us to be able to protect people. I'm one of 7 million people who has a compromised immune system in a country with 322 million. Not to politicize this, but this happens in a lot of jobs, where we have to acknowledge that situations are different and unique, and we have to accept that and help with that. So communication was one of the things I found most lacking. I teased my doctors. I said, well, the good news is the cancer's not going to kill me, but the stress is.
Yeah, well, and that's definitely something we find in our survey, our state of cancer survivorship survey, because we ask people about, what their concerns are: physical, financial, emotional, and mental health continues to be one of the top concerns of cancer survivors during and after treatment, and also the area where they get the least help because there's not enough providers. They're not. Sometimes I think oncologists don't necessarily want to ask about the stress and anxiety, depression, because they don't necessarily have the resources to support somebody if they say they have challenges with it. So I think that's a huge problem for cancer survivors.
Mhm. I have, again, I'm very proud of our healthcare system in Contra Costa County here in the East Bay, of which I was a part of in local government. And so I have a therapist that I get under the Contra Costa Health Plan, which was the first federally recognized public or county HMO in the country. My predecessor, Congressman George Miller, who chaired the Education Labor Committee that had some jurisdiction on this for 40 years, helped with that. But I have a therapist, and she's an MFT, marriage family therapist, but she specializes in cancer patients. So I met with her yesterday, twice a month, and that difference, all of that, why can't everybody get that? And it's more efficient if we do it that way. So trying to take these best practices and bring them to scale, which you do so well, and your support for my bill and the caucus is really important. We can save so many more lives based on the tremendous exponential research at the American Cancer Institute and NIH on cancer and other diseases. But deploying those assets is a real challenge. And as you say, getting young people to go into behavioral health and medical, but it's really daunting. Since the ACA and parity, there's a 75% increase for behavioral health services, but there's a 25% decrease in young people going into the field. So clearly we have a problem and that interconnects with your work. Obviously, it's not just the medical side, it's the behavioral health side and the family and the community.
Yeah. I have a question that since you kind of go back and forth between Washington and California, and it sounds like you get some of your care, or you've gotten some of your care in Washington and some in California. How has it been to coordinate that care when you have multiple different providers? Because I know that care coordination is something that could be helped by this legislation, by having a plan that outlines who's responsible for what. I know that sometimes when someone completes treatment and they go back to their primary care physician, it's not always clear who's doing what between the oncologist and primary care physician. And the burden often falls to the patient to be that coordinator of care. How did that work for you, receiving treatment from two different coasts?
It was daunting, and again, I had assets, not just as a member of Congress, but as somebody, as you said, in my bio, I was reasonably successful, although that's relative in the restaurant business. Um, so when I go to the county and I see people who don't have health care sitting right next to me, including this morning and yesterday, it's just that more daunting. And they have other pressures where they just give up. So that's not acceptable in the wealthiest country in the history of humankind. So I was lucky that my private health insurance, and for people watching, Congress used to have great benefits in health. We don't anymore, which is appropriate. But I'm lucky I have the insurance I have in the public health system that I've been part of. But I had to get my health plan to pay for my treatment in DC. So that was daunting. And if I didn't have, um, I wonder if I was poor and had to communicate out of the service area for my health plan, what it would be like. And I know it wouldn't have been as good, but it was still daunting.
Yeah.
I was lucky because there were a couple people who were really good at it and cared about me that said, we're going to make this work under the rules. So they didn't break any rules, but it was deploying the rules as they were and not just giving up and saying you can't do that.
Right. So I just wanted to shift gears a little bit and ask you about kind of the climate in Washington and getting things done. So many of us follow congressional news closely and know that the environment is challenging, to say the least. But we also know cancer is a nonpartisan issue that touches everyone. So even in this challenging climate, you continue to work on this in a bipartisan approach, working with Congressman Carter on these bills. So how hopeful are you that your legislation will pass in the current environment, and why is bipartisanship so important to you when it comes to cancer issues?
Well, I'm a former Republican. At 18 years old, growing up in Boston, my dad was a politician. He'd been in the legislature. He was a judge then. I wanted to vote for somebody named Ed Brooke, who, if you remember, people remember, he was a Republican U.S. Senator from Massachusetts with Teddy Kennedy. And the joke in Massachusetts was Ed Brooke was more liberal than. So the parties have changed. But I will tell you, I've been a city council member, mayor, county supervisor, a member of both houses of the California legislature, obviously the largest state, complex issues, and a member of Congress. And Congress is the most dysfunctional body I've been on. Plus, I've been appointed to separate boards and commissions here in California by Republicans and Democratic governors. It's just not working right now. And on the things we read about, it's clearly not working. January 6th, we have been through these periods in our history before, post-Civil War, after the Civil War. So I'm mindful that you can't give up, you got to stay at it. And cancer is one of those things where we've had some success, not as much as we should. The previous president was going to cut funding for the Cancer Institute and NIH. And a group of us just said, no, that's not going to happen. So we actually added $7 billion into funding, and that was bipartisan. So there are these significant victories, but it's a challenge. And I think for all of us who care about these issues, you can't give up. You have to just keep at it because we're saving lives and improving quality of life every day, not to the level we would expect, but those are conditions that oftentimes are beyond our control. What is in our control is continue to do what you do so well.
Thank you. Well, I appreciate you continuing to work on this. We've always, as a nonprofit organization, we always work in a bipartisan fashion and know that cancer affects everyone. So it's been, easier probably than some issues to work on on a bipartisan basis, but it's just hard when the environment is how it is right now. Are there any senators that are interested in working on this with you to try to get these bills introduced in the Senate as well?
Yeah, so we've had good communications, as you say. The caucus is bicameral in spirit, at least, but with busy schedules, it's always hard to get the survivors caucus. So we have. It's one thing to get people to work, as you know, the work we've done together is to get a lot of co-authors, co-sponsors, so we get to that critical mass where leadership goes, okay. And then even when you get there, you have to keep pushing that rock up the hill. So I have a meeting with one of my senators in a couple hours to talk about a variety of things, and this is one of the things. Senator Feinstein, as some of your folks will know, her husband, Dick Bloom, wonderful man, he had cancer and just died recently. So we will talk about it. So we're constantly looking for partners, and anything you can do to help us with that on a bipartisan level is appreciated.
That's great. So our audience members include many patient advocates who are going to be involved in talking with their members of Congress during our virtual Hill Week. So what is your advice to advocates when they talk to the members of Congress about these important cancer issues?
I think the way to communicate is a narrative, personal narrative, tell your story succinctly, but also have numbers with you to frame it. Because what happens in Congress is that I refer to the bright, shiny thing. Whatever is topical in the news tends to get the attention by staff and more by members. So you've got to remind people about the great progress we've made. But there's still almost 2 million people every year who get diagnosed with cancer in the US. And the survivorship rate is really remarkable, exponential change. You're probably aware of the Kaiser Foundation study recently of life expectancy for people over 65 in the United States and then regionally. Remarkable. I mean, remarkable what in our lifetimes we've been able to do. So you have to remind people in Congress that this is going on, but we need to do more, and there's no reason not to.
Right. Great. Well, thank you very much for your time and for your advocacy for these important issues. It's really, I think members of Congress hearing from one of their own about what you've been through as a cancer survivor really makes a difference in getting support for this legislation. And we appreciate all that you do and your time here today. Thank you.
Thank you for inviting me. And one of the things I'll just end with is I was shocked that there was a stigma attached to the diagnosis. The New York Times just did a story this weekend about that when you hear cancer, you still think it's a death sentence, and it's not.
Right. Yeah. And it used to be, and that's really what brought our founders together, because people were starting to live longer after their diagnoses, but there was no support for them to, put their lives back together afterward. And now people are living longer and longer, even with advanced and metastatic cancer. So it's important to remind people that, it isn't a death sentence. We do have a lot of treatments, and people want to live well with cancer during and after their treatment. So that's what we really focus a lot on, is the quality of life, not just getting the treatments that extend your life, but having a good quality of life.
Yeah, I'm a better person and a better member of Congress for having had cancer.
Wow, that's great. I mean, that's an important statement, and I think people who've been through it understand it, and I know that physicians who've had cancer, like, it totally changes their perspective on how they take care of their patients. So we're lucky to have people like you in Congress. So thank you very, very much.
That's not to say to run out and try to get cancer.
No, I don't think anybody will do that, but it's good to know that it's made you better at what you do.
Well, thank you all so much for what you do. Let's keep doing it. Let's get these bills passed.
Yes.